Hello, I'm Dr. Brian Perkinson. We've made you this educational video for your upcoming joint replacement at Williamson Medical Center. Please watch it and learn.
Hello, I'm Dr. Colin Looney. Our joint team put together these very helpful videos. I hope you enjoy them and find them very educational. Thank you.
Hi, my name is Richard Hamilton. I'm a physical therapist here at Williamson Medical Center, and I'm part of the joint and spine team. Now that you've decided to have a knee replacement, we'd like to go over some of the highlights of what you can expect before you have your surgery. When you come in for your pre-admission testing, you'll receive a book, The Ins and Outs of Joint Replacement, which will be a comprehensive review of everything you need to know. In this video, we're about to hit the highlights of that book. Let's get started. It's important to prepare your home before you have surgery. When you come home, you can expect to most likely be using a walker. Sometimes the walker can tend to get tangled up in things like throw rugs, loose cords, anything else that might get in your way and trip you when you're using a walker. Keep in mind that small animals often can be problematic when you return home using a walker. You may want to make some kind of accommodation for that. If you have stairs, it's highly recommended that you have a handrail. It's very difficult to go up and down stairs without a handrail after surgery. It's also important that your home is adequately lit. We recommend considering night lights for when you need to get up during the middle of the night. Motion lights are excellent. The bathroom is one of the most dangerous places, especially after surgery, because you've got a slick surface and lots of sources of water. We usually recommend some kind of a shower chair rather than standing to bathe. Grab bars can also be very helpful as just another apparatus to hold on to, and possibly a toilet riser if you're going to have difficulty getting up from your toilet.
Hi, I'm Amanda Marson, and I'm one of the nurses on the Joint and Spine Center. I'm going to talk to you a little bit about staying healthy prior to your surgery. We want to keep you as healthy as we can prior to surgery. Part of that is protecting your skin. So if you're outside, you want to wear things like bug spray to protect your skin so you don't get infection. When you come in for your surgery, if you have any signs of infection, that could cause your surgery to be rescheduled. So please try and stay as healthy as possible. One of the side effects of your pain medicine is constipation. So it's important that before surgery, you don't come into the hospital constipated. We recommend that you have a bowel movement before you come in. You can take an over-the-counter stool softener to help with this. If you're diabetic, it's very important that you maintain your blood glucose levels. Maintaining your blood glucose levels helps promote healing and keeps you healthy after surgery.
My name is Lisa Matthews. I'm one of the registered dietitians here at Williamson Medical Center, and today I'm going to talk to you a little bit about the importance of having good nutrition prior to your surgery. Also, something to keep in mind, protein is important after any kind of a surgery. Protein aids in wound healing. Also, whenever we're inactive for 10 days even, we can lose up to 2 pounds of muscle. So to help prevent that muscle loss, we recommend snacks that are high in protein, high in fiber. You may be on some pain medicine, which can cause constipation. So to help prevent some of that, we recommend foods that are higher in fiber and drinking plenty of fluids. Some good examples of things to have at home before you go in for your surgery are these high fiber crackers along with tuna. This packet is wonderful because you don't have to drain it. You just open it, place it on the cracker, and it makes for a great high fiber, high protein snack. In addition, we have Greek yogurt here. Greek yogurt is a higher amount of protein than normal yogurt, so this is an excellent choice for a snack as well. Trail mixes, nuts are high in fiber and as well as a good source of protein. These are great to have on hand. After your surgery, you're not gonna feel like being in the kitchen, doing a lot of cooking, so these are excellent to have around at your house. Also, we've got these drinks. There's many versions of these in the grocery store. The higher protein version that has the lower amount of calories is an excellent choice. Those will also help you maintain a good weight. We want to maintain a good weight because being obese or overweight adds extra pressure to our joints. So eating a great balanced diet, high in lean proteins and fiber, low in fats and sugars will help you do that.
It's important that you plan ahead to have someone stay with you for the first few weeks after your surgery. On your day of discharge, it's best if you have someone at the hospital by 2 p.m. who can help take you home. Getting in and out of a car can be difficult, so please plan ahead to have a small SUV or mid-sized vehicle that's easier to get in as you're discharged home. While you're at the hospital, you'll be receiving a lot of education, so we recommend that you have your family and support participate in that education while they're here.
Hi, I'm Frances Scott, Nursing Director of the Joint and Spine Center here at Williamson Medical Center. I'm going to talk to you a little bit about what happens the day before surgery. You will receive a call from us stating when to be here the morning of surgery. You also have met with anesthesia team that will tell you which medications to take before surgery and also when to not eat or drink before surgery. Please make sure you follow these instructions as directed. Please bathe with the antibacterial soap given to you prior to surgery. This soap helps remove germs from your skin and prevents infections. Please remember to bring your booklet, The In and Out of Joint Replacement Surgery, with you while you're here in the hospital. We can use it as a workbook, and we can use it also as a reference during your stay with us.
Hi, I'm Samantha. I'm a nurse here at Joint and Spine Center at Williamson Medical Center. I'm going to talk to you today about getting ready for surgery. So when you get here, you'll come to your room where we will have you sign your consent. From there, we'll have you wipe down with our chlorhexidine wipes. These will help prevent any kind of infection, as well as getting into a purple gown for surgery. So after we get you all set up, you will be in your room until they come and get you for surgery. From there, you'll be about 3 or 4 hours. So if your family is here and they have any questions at all, they are more than welcome to come find a staff member or a nurse up at the desk to ask any questions. After surgery, you'll be brought back to your room where we have 2 main goals, mobility and pain control. We'll be getting you out of bed as soon as you're back from surgery. Mobility helps prevent any kind of complications. Second goal is pain control. We want to keep your pain as tolerable as we can so that you can look forward to therapy and be able to regain your mobility faster. After surgery, we also encourage deep breathing. Anesthesia, drowsiness, being in bed can all prevent you from taking good deep breaths. That's why we use the incentive spirometer. With your incentive spirometer, you're going to wrap your mouth tightly around the mouthpiece. And here you will take good deep breaths by inhaling, kind of like sucking on a straw. As you see, taking good deep breaths moves the indicator up. Our main goal with the incentive spirometer is to prevent pneumonia after surgery or any other complications from anesthesia. You will do this about 10 times after surgery every hour. Another important thing to remember is that if you have a CPAP, to bring it with you the day of surgery so that we don't have any other further complications with breathing.
After your surgery, you can expect to be receiving physical therapy. A therapist will most likely be in to see you just a few hours after you return from surgery. We'll get you up and moving and start with some basic exercises. We encourage you to start those exercises as soon as possible, even today. They're included in your workbook, The In and Outs of Joint Replacement, and we'll review them now. Just remember, the stronger you are going in, the stronger you'll be coming out, and the easier your physical therapy will be. We'll now let Kristen Story, physical therapist at Williamson Medical Center, review some of those exercises with you.
Hi, my name is Kristen Story, and I'm a physical therapist at the Joint and Spine Center at Williamson Medical Center. While you are here, physical therapists will be working with you to help regain your strength and your range of motion. I'm going to be going over some exercises with you, and we'll want you to do these 3 times a day for 30 repetitions each. This exercise is called quad sets. For this exercise, you're going to take your operative leg and tighten the muscles on the front of your thigh, which will push your knee down into the bed. You want to hold that for 3 to 5 seconds and then relax. You'll repeat this 30 times and do it 3 times a day. This exercise is called Glute Sets. For this exercise, you'll tighten the muscles in your rear or your bottom, hold for 5 seconds, and then relax. You'll repeat this exercise 30 times, 3 times a day. This exercise is called ankle pumps. To perform this exercise, you're going to move your ankles up and down either in the bed or sitting in a chair. We ask that you do this 10 times every hour you're awake. This exercise is called heel slides. Taking your operative leg, you're going to slide your heel up towards your bottom as far as you can get it, and you want to push through the pain. You want to perform this 30 times, 3 times a day. This exercise is called hip abduction. Keeping your toes and your knee pointed straight up towards the ceiling, you'll want to slide your leg out to the side and back into the center, being careful not to cross midline. You'll perform this exercise 30 repetitions, 3 times a day. This exercise is called short arc quads. Folding up a blanket or pillow or even using a playground ball, you want to place it underneath your knee. Keeping your knee on top of the surface, you want to kick the lower part of your leg up so that your leg becomes fully straight, and then lower it back down nice and slowly. Make sure your knee stays on the object you have it propped on. You'll perform this exercise 30 repetitions 3 times a day. To perform stairs, you'll want to go up with your non-operative or stronger leg first, and then bring your operative leg to meet it, making 2 feet end up on each step. You'll continue this sequence until you've reached the top of the stairs. To come down the steps, you're going to come down with your operative leg first. Next, bring your stronger leg down to meet your operative leg, making 2 feet be on each step. Continue this sequence until you're all the way down the stairs. This exercise is called a static extension stretch. You'll prop your heel up on a pillow or towel roll so that there is nothing underneath your knee. The goal of this is to help your leg get straighter and push into extension. We hope that you can hold this for up to 15 to 20 minutes, starting out with a minute or 2 the first time. This exercise is called a straight leg raise. You're going to bend your non-operative leg, and keeping your operative leg straight, you're going to lift it, keeping it nice and locked and straight to the height of your other knee, and then you'll slowly lower it back down. We want you to perform this exercise 30 repetitions 3 times a day. This exercise is called seated knee flexion. While sitting in a chair, you're going to bend your operative knee so your foot slides back under the chair. Hold it for a second or 2 and then slide it back out. You'll perform this exercise 30 repetitions 3 times a day.
Getting you ready for discharge is a team effort, and you're the most important part of that team. But it also includes your doctors, your nurses, your physical therapists, your occupational therapists, and case management. Our goal is to develop a plan that fits your individual needs. If you require any equipment or supplies, we'll work to ensure that you have them before you're ready to go home. Tanya Smith is now going to talk with you a little bit about the discharge instructions you'll receive before you go home.
Hi, my name is Tanya, and I'm a nurse at the Joint and Spine Center here at Williamson Medical Center. We want your transition from the hospital to home to be as smooth as possible, so we are going to provide you with discharge information before leaving the hospital. You will receive instructions on how to take all of your medications at home prior to discharge. If you are taking a blood thinner, you will receive information from our pharmacy team here at the hospital, and you will also receive a prescription if indicated. You will also receive specific instructions on how to care for your surgical incision upon discharge. Please be sure to watch for signs and symptoms of infection, such as redness, heat, separation of your incision, or a fever greater than 101.4. If any of these signs or symptoms occur, please be sure to contact your physician. The normal progression for your pain is for it to improve on a day-to-day basis. If you are taking your pain medication as indicated, and this is still not improving your pain control, please call your physician. Our goal is to keep your surgical dressing clean, dry, and intact. If for any reason your dressing becomes saturated, please remove the dressing and call your physician. We also want to prevent blood clots. It is important to be able to recognize the signs and symptoms of blood clots, such as increased pain, redness, or swelling in that calf area. If any of these do occur, please contact your physician. Also call your physician if you have any unresolved abdominal issues, such as nausea, vomiting, or you are unable to have a bowel movement. Please remember, if you have any trouble breathing or chest pain, this is always an emergency and you need to call 911. Continue to take your pain medications as indicated upon discharge and watch for side effects such as constipation. Your doctor will prescribe over-the-counter stool softeners, so please be sure to take those as indicated. And remember to eat healthy, protein-rich foods to help promote healing. Continue to move and do your exercises as instructed. Please avoid sitting for long periods of time. And when you are at home taking care of your incision, it is okay to shower over your incision, but please avoid submerging in any type of water such as bathtubs, hot tubs, or swimming pools. Do not apply lotions, creams, or ointments unless indicated by your physician. And please remember, you cannot drive until you are cleared by your physician.
A follow-up appointment will be made with your surgeon's office a couple of weeks after your surgery. If you have any needs, you can feel free to call the office 24/7 as someone will be on call to answer your phone call and take care of your needs.
On behalf of myself and the entire team at the Joint and Spine Center, we would like to thank you for choosing Williamson Medical Center for your orthopedic needs. I hope the video has been helpful in getting you ready for your surgery. Please remember that the two main goals is that we get you up and walking the day of surgery and that we keep your pain as tolerable as can be. For more information, please call 615-435-6454 for information on our live joint classes.